Hey everybody, Dr. Dave here
And Amy, how
Sure.
are you?
from Shore's Wellness Solutions, the Natural Health and Wellness Center. And today we're going to be talking to you about blood pressure.
Blood pressure.
Boom, boom, boom.
I know who can raise my blood pressure.
I would say that would be me.
Oh, maybe. I don't know. Does anyone have anyone that can help raise their blood pressure every once in a while?
Sure.
Anyway, we're going to be talking about blood pressure today and ways that you can help lower your blood pressure and some of the effects of having
Lower
high.
your blood pressure. Is that what you were going to say?
Oh, this is going to be a fun one. Anyway, so thank you for joining us today. We're going to be talking about blood pressure, how to lower your blood pressure, and some of the side effects of having a elevated blood pressure. So we have a lot to talk about, so we're going to dive in and get started. So, Dr. Dave,
Yes.
what is blood pressure anyway?
Let's take a look what we mean by that, right? So blood pressure is the force that is needed to push blood through your vascular system, the arteries, coming from the heart, to deliver oxygen-rich blood to all over the body. It's blood pressure, the force that's needed from the heart to deliver blood to the body. That's it.
So what's a normal blood pressure reading?
Oh, normal.
I
Yeah.
know.
It's like when
You know I'm
people say,
going to
what's
ask.
good, what's bad.
You know I'm going to ask that, right?
So textbook normal is 120/80.
Right.
That's textbook normal. The top is your systolic number, that's your heart beating. The bottom is your diastolic, the heart at rest. And so you need to understand that the systolic, the top number, 100, and people are going to, your medical doctor will be like, no, 100 to 140 is good on the top number, and the bottom number, 60 to 90 is the range.
Look at that. Well, having an elevated blood pressure in just one of the two values is enough for a hypertensive diagnosis. So you have to really pay attention to your blood pressure because we're going to learn why it can cause so many different things.
Yeah, and I disagree with the AHA. You probably say, well, the AHA knows a lot more than you. I don't know. Our diet, the liver enhancement diet, blows away the American Heart Association diet by far as getting sick people well. So I would definitely say that, yeah, some things we do better.
Yeah. Well, let's start by understanding what high blood pressure actually is. When the pressure required to circulate your blood is high, it places an abnormal amount of stress on your heart muscle and smaller arteries and reduces the amount of oxygen that's delivered into the smallest blood vessels in your body. Both of these consequences amount for many of the secondary effects of hypertension. So some secondary effects include cough,
Diarrhea, constipation, dizziness and lightheadedness is a big one. Erectile issues, feeling of nervousness. No, I'm just kidding. Feeling of nervousness, feeling tired, weak, drowsy, lack of energy.
you can have headaches, nausea, vomiting.
Low initiative. Those are effects of higher blood pressure.
Yeah, so some common causes of high blood pressure, according to medical physiological textbooks, as much as 95% of hypertension is called essential hypertension, meaning the underlying cause is unknown.
Yeah, that's a textbook.
Yeah, well, this simply isn't true. Right?
Know.
That's what I was trying to say. But somebody likes to talk a lot and not
That's
let
all
me
right.
finish my sentences.
I'll let you finish.
Go
Thank
ahead. Unless you want to go.
Well, there's a lot of factors that are involved with looking at what's contributing to high blood pressure. It could be insulin and leptin resistance, those are two hormones in the body. And so if you are having problems with those hormones, your blood pressure can go up and you'll be hypertensive.
Right? Poor nutrition in childhood has been shown to raise the risk of high blood pressure in adults as well. Elevated uric acid levels are also significantly associated with hypertension. And so you want to make sure you're normalizing your uric acid levels in order to maintain a normalized blood pressure.
Air and sound pollution, same thing. They can lead to it.
Right? And what does that mean?
What do you mean? What does it mean? When there's noise pollution
Yeah.
and air pollution?
Yeah.
Okay, that just means that your environment's polluted with noise and toxins.
So is that lots of kids running around being wild and
Oh,
crazy or...
Well, it's stressful to the body. And so I know I'm playing a little bit with this, but it is stressful to the body. And when you add stress to the body that's prolonged or high stress, the adrenal glands get involved and they produce excess cortisol. And that excess cortisol causes vasoconstriction, which means it constricts the blood vessels. And if the blood vessels are constrict, the heart has to beat harder to push blood through the system.
Right.
And if you've ever gone to a doctor's office and your blood pressure is elevated while you're there, white coat syndrome, that's what's going on. It's a stress response.
Right. Well, unfortunately, 20% of people who suffer from high blood pressure are unaware that they even have it in the first place. It significantly increases their potential risk of health problems. So if it's uncontrolled or poorly controlled, you increase the risk of healthy effects such that will reduce the quality of your life and have an effect on your lifespan. Hypertension increases your risk of stroke. It can cause blood vessels in your brain to rupture or clog more easily. And in both instances, oxygen supply to a portion of the brain ceases, resulting in a stroke. So it's really important to pay attention to your blood pressure as well, because you don't want to have these risks. And a lot of people not knowing that they have high blood pressure in the first place is, definitely more at risk.
And with hypertension, you're going to get more damage to the smaller arteries. It's going to reduce the oxygen delivered. It's going to lead to organ dysfunction, particularly in the kidneys and the eyes. You'll start to notice that. Right.
So there's a lot you want to pay attention to when it comes to blood pressure.
Blood pressure? Blood pressure.
Oh, Lord.
Yeah. So it's estimated that 1 in 3 people in the United States do have high blood pressure, and another 1 in 3 have pre-hypertension. So we're talking about 2/3 of the country. And so, how can that be? Is it something that's genetic to people in the United States? No, it's not.
No. I think people in the United States consume a lot.
We call it white trash.
Yeah.
Bread, pasta, cereal, biscuits, muffins, pancakes, waffles, donuts, bagels, cookies, cakes, candy, pizza, roti, naan, and empanadas.
I thought we were going to get by without you saying that for just one class.
Not
nope, not today.
Not today.
Well, one particular study found that older adults having an elevated average systolic blood pressure puts you at a greater risk for brain lesions, and that is associated with Alzheimer's disease. So the average blood pressure of the seniors enrolled in the study was 134/71, and 87% of them were taking medications for high blood pressure. The participants were followed until death for an average of 8 years, and the average age at death was 89. Researchers found that the risk of brain lesions was higher in people with a higher average systolic blood pressure across the years. For a person with one standard deviation above the average systolic blood pressure, for example, 147 versus 134, there was a 46% increase of having one or more brain lesions.
It's a lot of numbers.
You're usually the number guy, right?
I know.
I'm surprised you don't like all the numbers. Look at me knowing all the numbers today.
I'm just looking at that thinking, why not just say that if blood pressure remains high, it increases your risk for Alzheimer's?
Well, it does. But there is a lot of factors that play a role in that as well.
There certainly are.
All right, well, go. You talk about the numbers that you would like to talk about.
Oh, the numbers I'd like to talk about, boy.
I know you're going to go with different numbers, so go for it. It is.
So back in 2012, 2013, a study was released from Europe saying that those over 65, if you had a blood pressure of 140/90 or lower, you're fine. Leave it alone, you'll experience longevity and good health. And then in the United States, they ran with a study and they stopped it prematurely due to overwhelming success, which means let's stop it before we prove ourselves wrong. And what the study in the US showed was, no, 120/80 or below, and we can give you up to 3 blood pressure medications to get you there. Well, they went back and looked at the European study and they said, whoa, look at this. People over 65 with a blood pressure of 150/100 or lower and left alone experienced good health and longevity. And if they gave them blood pressure medications, then what would happen is they would become sicker and have a shorter lifespan. So which one do you believe?
I don't know.
I have my ideas.
Right? Yeah. Well, let's talk a little bit too how diet influences your blood pressure.
Huge.
One of the most important dietary changes needed to be made in order to lower your blood pressure and improve it is to dramatically reduce your sugar intake. especially processed fructose in your diet.
Mm-hmm.
Do you want me to go with another study or no?
Go for it.
Look at
Not
in
really.
2010. In 2010, one study discovered that those who consumed 74 grams or more of sugar per day of fructose, which is equivalent to about 2.5 sugary drinks, had a 77% greater risk of having high blood pressure levels of 160 over 100. Consuming 74 grams or more of fructose per day also increased the risk of blood pressure reading by 26% and a reading of 140 over 90 by 30%. So eating sugar is a huge component to raising your blood pressure.
And then you have trans fats, hydrogenated oils, and that causes atherosclerosis or hardening of the arteries. And if the arteries are hardening, what happens? The blood pressure has to rise in order to pump the blood through the system. And we find those a lot in margarine, vegetable oils, butter-like spreads, not butter, butter's good for you, and baked goods. And why? Because the hydrogenated oils give baked goods a longer shelf life. And so that's why we want to stay away from them.
Yeah, the easiest way to cut both sugar and unhealthy fats from your diet is to replace your processed foods with real whole foods. Very important. What's a real whole food? Do people know what real whole foods are today? I'm wondering.
Things that are home baked, maybe?
No.
What?
Maybe the vegetables out of our garden. That would be a great one. You've been seeing all the posts about lots of vegetables that we've been growing and consuming. That's a real food, right? So, what other things affect blood pressure?
Potassium levels, huge, will affect blood pressure. And so if potassium levels are low, your blood pressure will be higher. Yeah, a little tickle in the throat there.
Struggle bus today.
Yeah, a little bit. Oh, that's okay. But yeah, it's so important. And I'll tell you, I can't use the word all, most medical practitioners really don't know how to read a blood test holistically. And I put that word in there because I want to say it right. I don't want to get anybody in trouble, people calling up being angry, but that's okay, they can. So when you look at a blood test, like with potassium, you have to not just look at that it falls in normal value, you have to compare that with sodium, and are they in proper ratio? So next time you have a blood test, ask your medical provider, hey, is my sodium and potassium level in proper ratio? See what they say. And then you can call us up and we'll tell you what it should be.
Right.
I'm not giving that one away. It should be 30-1. All right, there you go. 30-1.
I'm like, yeah.
So sodium, you take your potassium level and you multiply that by 30, and that should give you your sodium. Or if you're really tricky, take your sodium, divide it by 30, and that should be your potassium. And we see many, many people where it's off, where potassium is just too low to support that sodium. And when that's off, the nervous system's not going to work right. You're going to have some adrenal distress, and your blood pressure is going to go up. And when we get that ratio back in normal, that's one of the things that helps to balance out blood pressure.
Yeah, some of the foods that you can do to up your potassium level would be broccoli, Brussels sprouts, dates, apricots. Those are some good choices to increase your potassium level. And you want to really be careful with eating bananas to increase your potassium, because bananas have a lot of sugar content in them, which is going to kind of have a counterproductive effect.
Right. Do you want to know something instead of bananas?
What?
Potatoes. Potatoes have a lot of potassium.
Like sweet potatoes? Or regular potatoes, or both?
Red potatoes, sweet potatoes, purple potatoes.
Well, the gut plays a big role also in blood pressure. Your intestinal bacteria are part of your immune system, and researchers have discovered that microbes of all kinds play an instrumental role in countless areas of your health. So beneficial bacteria also control the growth of disease-causing bacteria competing for nutrition and attachment sites on your colon.
Yeah, and this is really of immense importance, because pathogenic bacteria and other less beneficial microbes will wreak havoc with your health if they gain the upper hand. And so it'll also affect your weight, and that's really important. So moreover, your gut microbiome, which contains 100 times as many genes as your body's total genome, that's a lot, right? It's involved in the importance of chemical reactions that your gut enzymes cannot perform, including fermentation and sulfate reduction. So that's really important.
Right. Using a probiotic to help normalize your blood pressure is a great way to help balance out the bacteria in your gut. Now, not all probiotics are the same, so you have to be careful with that as well.
And most probiotics are not antibiotic resistant. So if you take a probiotic and you've taken an antibiotic, you're just going to wipe them out. So that's what I love about Standard Process. The probiotics we have are antibiotic resistant just because of what they're made from.
Right,
Whole
exactly.
foods.
Another thing you can get in the habit of doing to help lower your blood pressure is eating fermented foods every day.
Like sauerkraut on your hot dog.
On your hot dog.
No hot dogs, but sauerkraut's where we go with that. It's just fermented cabbage, that's all it is.
Right. So keep in mind that you want to know the difference between traditionally fermented foods and commercially processed fermented foods, which they just add a probiotic to. So you want to, as a general guideline, you want to eat about a 1/4 cup to a 1/2 cup, 2 to 4 ounces of fermented vegetables or other cultured foods, such as raw yogurt or kefir, with 1 to 3 meals every day. Regularity is important if you're looking for the health benefits. So doing it once a year is not going to really give you the benefits that you're looking for. So you're going to want to make sure you're consuming these things on a regular basis in order to get the benefits.
And gut health is so important because, besides the blood pressure issue, if your gut health isn't properly aligned, you're not getting the right probiotics in there, into the gut, that is, then what happens is it also then starts to affect mood. Then you start to see like anxiety, depression, irritability, moodiness. I can keep going, but I won't.
Right, right. So another type of diet that's going to help balance your blood pressure as well is the Mediterranean diet. That's something you talk about
I
a
love
lot.
the Mediterranean.
That's
right. And if you want the interpretation of that, that's Mediterranean. Okay? And it's called that because it's from the Mediterranean region in the world, and that's where you're getting a lot of olives, fresh olive oil, fresh vegetables, fruits, seafood in there. Infrequent red meat consumption. So it's not zero red meat. It's just from time to time. But it is more the fruits, the vegetables, the oil-rich things that grow. That's how I always describe it.
Exactly.
Healthy fats.
Oh, we're going to talk about something fun that can help reduce blood pressure. One of my favorite things, essential oils. They're very simple, they're easy, and very effective in lowering your blood pressure. So if you don't... Why are you laughing?
Listen.
If you don't know what an essential oil is, they're oil from the plant that's highly concentrated and created through distillation. So basically they take specific parts of the plant, the barks, the leaves, the roots, and they condense it into a very concentrated oil. But there's a lot of essential oils that are really good for lowering blood pressure and heart health. A few of the oils that are my favorites would be bergamot, right? Bergamot is got a great refreshing scent, and it also helps to reduce your blood pressure, helps to reduce anxiety, improve your mood as well, which when you have a good mood and your anxiety is low, your blood pressure lowers as well. Clary sage is another oil that is really good to help reduce your respiratory rate. And it also decreases symptoms of stress and depression.
Rose helps.
Yeah.
Frankincense, one of my favorites.
I was going to say you use that. Well, I use that every day as well.
Lang Lang.
Yep.
And it does help. I don't just like saying that. Lemon balm, lavender are some good ones.
Yeah, because you want to make sure you're balancing everything. And if you're not sure how to use them, there's a few ways. You can pop them in a diffuser and diffuse them out throughout the air. You
Put
can
them on your skin.
Exactly. Putting them on the bottoms of your feet. You have the largest pores in the bottoms of your feet, so it gets into your system within 30 seconds. So that's something you can do every day. And if you're using a pure oil like doTERRA's essential oils, you can also take them internally as well. So just make sure you take a look at the bottle and make sure it says that you can. There are a few oils you don't want to take internally due to the fact, like a tree bark, something that you wouldn't eat naturally, you don't want to ingest that. But anything that you can eat, wild orange, lavender, anything like that, you would be able to take internally as well for lots of benefits.
Awesome. Can you use exercise? Exercise is important. So as you exercise, that releases a whole line of hormones in your body and endorphins to help reduce the high blood pressure and reduce the risk of heart attack. So exercise is important. And not just cardiovascular. We know that strengthens the heart, but resistive activities are important in this as well.
Right. Research shows inactive individuals have a 30 to 50% greater risk for high blood pressure than active counterparts. So it's important to include some exercise in your diet every day.
I like using whole food supplements to reduce blood pressure. We have some great ones. We know we can use calcium lactate. We can use Cataplex F. That helps. The Cataplex F helps to get calcium into the tissue, which lowers the blood pressure as well. We can use organically bound minerals for those that are deficient in phosphorus, and we also have Cardio Plus, which helps get oxygen from the lungs to the bloodstream, and the bloodstream into the organs, and that also can help. So that we have a multitude of things. Those are just 4 that we use, but there's a bunch that we use to really help with the physiological effects to bring blood pressure down.
Right. And another thing you want to do is to address your stress levels. Having very high stress levels can also increase your blood pressure as well. So you want to make sure you can find an outlet, whether that's exercise or using the emotional freedom technique is an easy to learn, easy to use technique for releasing negative emotions. So there's a lot of things that you can do to calm yourself and help to release.
Take your dog for a walk.
It's an easy one to do as well. Look at that. So I know we're covering a lot today. So if you're feeling overwhelmed by any of the information that we're discussing or talking about today, make sure that you message us in the comments. Any questions that you may have, we'll be happy to answer them. And if you're wanting to come in and have an evaluation or anything like that too, just to see how we can help you to lower your blood pressure, we'd be happy to do that. What's your comment?
You do a great job preparing these.
Thank you.
You're welcome.
All right. Well, I was meaning more of a comment about blood pressure or anything that we could do to help you in lowering your blood pressure. So please feel free to reach out to us if you have any questions about anything that we've discussed today. We'd love to hear your thoughts about this class. And tell us what your number one takeaway is. What's something that you learned about lowering your blood pressure that maybe you didn't know about, or a question that you have that you would like to know more about that we didn't cover today. Ask it in the comments section, and we would be happy to answer that for you. Anything else you wanted to share about blood pressure today before we sign off?
No, ma'am.
All right. Well, we want to thank you for joining us today and learning about how to lower your blood pressure. And we look forward to talking with you next Thursday. We'll be back here again live talking about our 21-day purification program. Awesome. So that's going to be a great class. You want to make sure you register for it, because we're going to talk about the benefits of purification so you can clean out your system of the toxins and things, which is also great for
particularly
lowering.
After you accumulated all these toxins this summer by being stuck indoors.
Right. But it also helps to lower your blood pressure.
Yes, it does.
So it would be awesome. So make sure you join us. Mark your calendars next Thursday at 1 o'clock. And we want to thank you for joining us today. I'm Amy.
I'm Dr. Dave, and we want to be your inspiration
for healthy living. Bye, guys.
Bye.
Thank you.